It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
First guest today, Dr. Brad Younggren, the Chief Medical Officer from 98.6. The topic is on-demand primary care. What do we mean by that?
On-demand primary care. That means you can access your physician virtually over your phone to start engaging in questions and get treatment, medical care on demand, on the bus going to work, at your office. Very convenient. On demand is kind of the new thing of healthcare.
Absolutely. Dr. Younggren and Shannon O'Kelly.
Dr. Younggren, welcome to Health Talk. How are you doing today?
Great. Thanks for having me.
Well, thanks for joining us. You have some interesting stuff going on. You're a busy guy, aren't you? I mean, shoot, I was reading a little bit in the background. First of all, I want to give you a big shout out and thank you for your service. I mean, you served in the Army as a medic and you were overseas and you were awarded the Bronze Star. That's pretty cool. Tell us about your service, and your experience with the Army.
I appreciate it. Thanks. I was an emergency physician in the military. I went to the military medical school, spent 15 years on active duty, most of my time stationed down at Madigan Army Medical Center here relatively locally, besides some tours of duty in places like Iraq, where I supported the Stryker Brigade in combat, and that's where I received the Bronze Star. So it was a great experience in my life. I really enjoyed taking care of soldiers. So
wow, I mean that's amazing. What an experience, huh? I mean, probably kind of set you up for what you're doing now. You're currently now a chief medical officer for 98.6. I mean, our listeners are going 98.6. That's the temperature that your body's supposed to be at, right? So tell us about 98.6. I'm fascinated by what you're doing. So I'm sure our listeners are also going to be fascinated. Let's talk about 98.6.
Appreciate it. Thanks. So 98.6 is a virtual text-based primary care app experience. We're in every state, including D.C., running a 24/7 operation with an AI sort of backbone. We have physicians that operate in all 50 states plus D.C., providing service 24/7 with adult and pediatric care.
Wow, interesting. So can kind of virtual telemedicine, medicine on demand type stuff, some of the new technology, it's kind of the wave of the future. As a physical therapist, president of IRG, we're doing some telemedicine in the musculoskeletal realm. And I think it's fascinating because a lot of people are looking for that flexibility, convenience. A lot of people are working at home. A lot of people are looking for virtual opportunities. You mentioned the word AI. I assume that's artificial intelligence. That's pretty good for me, isn't it? Yeah, that's great. That's all right. Yeah, that's pretty good. So tell us about how it works. I kind of want to get into it. Like when you talk about AI, I assume the patient is inputting something via text message. AI is looking at the question and going to start kind of drilling down almost in a history physical type thing from an kind of an intellectual standpoint.
Correct. Yeah. So we have apps. Most people enter into 98.6, the virtual clinic, either through the Android app or the iOS app. And essentially, it's a less than 2-minute sign-up period, gets you into the app virtual clinic, and you just essentially press the button and you open your experience. You're immediately talking to the AI, which will ask you broadly what brings you in today, just as if you walked into your primary care physician's clinic. As opposed to some other symptom checkers and things you may see on the market, we really allow the patient's voice to be heard. They can really say anything they want. And the patient will have a typically text-based conversation, although we do have video and phone capabilities built into the technology, of course. And they'll drive through a conversation with the AI, and at some point the AI will hand off to one of our board-certified U.S.-based primary care physicians who will complete the medical interview as needed and provide a treatment and a care plan on the back end of that as well. Our physicians are licensed in all 50 states plus D.C., so they can essentially provide ubiquitous care across the entire country 24/7. We order labs, we write electronic prescriptions, and bring patients back to the virtual clinic to discuss those labs, thereby sort of lowering costs by abating a bunch of kinds of visits across the board.
It's amazing. The technology, both in the application of medicine, but also just in the intervention in medicine today, is fascinating. So let's kind of set this up. I wake up one morning, I'm not feeling well. I get on my phone. I have this app that's 98.6 app. I've loaded it. We're kind of following the balancing ball here, if you will. And I put information in. I'm going to be asked some questions, and then I'm engaged in an appointment right there. Is that kind of how it works? And then down the road I'm going to be introduced to a primary care practitioner?
Correct. So, you can enter your primary care physician if you have a brick and mortar one, your preferred pharmacy, your past medical history, the medications you're on, and your profile ahead of time. And that allows us to really get a holistic perspective on the patient and deliver the best care possible for you. But yeah, you can be in bed. You could decide on a bus on the way to work you need to talk to us. You could be in a meeting. It really doesn't matter.
All right, we continue our conversation on on-demand primary care. Dr. Brad Younggren and Shannon O'Kelly when we come back on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
More on-demand primary care now with Dr. Brad Younggren and Shannon O'Kelly.
Dr. Younggren, thank you again for joining us. Thank you for talking to us about 98.6. Fascinating stuff. Virtual medicine, on-demand medicine. If you have access to internet, you can get medical care.
Yep.
Anywhere in the world.
Well, if you have access to that or 4 or 5G, you basically are connected to 98.6, and you can do it anytime you want. A high percentage of our patients do access the service in non-traditional settings, in between meetings at work, on the bus on the way to work. Like whatever meets their needs on their typical day, it really truly is on demand on their terms, which is what patients need in this day and age.
Now, I'm sure, as you guys assess the patient's condition and things like that, you're going to be able to refer to a specialist, make that determination, and guide that patient if they need further medical intervention.
Correct. Yeah, we resolve a high percentage of the cases that typically would need a brick and mortar primary care visit. However, you're correct. We do send patients to the emergency department when appropriate. But again, those are typically patients that need to be in the ED. That have been evaluated by a physician to determine that the ED is the best location for that case. But we do refer a small percentage of patients to an ED or urgent care as appropriate.
Okay, so I know our listeners are going to be the complexity with medical insurance out there and healthcare insurance. I'm sure some of our listeners are going, wow, is this covered? Is this paid? You have to tell us about that kind of process for you guys.
Yeah, so great question. We have a couple different channels we work in. We work with employers who typically are supporting and paying for the patient's service. That can typically be free or a very low copay for an HSA plan. There's a direct consumer offering. You can go down to the App Store right now, pay a nominal fee. I think it's currently $20 for the first year for unlimited access to 98.6.
Oh, wow.
So that's another option for people who aren't sort of accessing 98.6 through the employer channel. We also work directly with a number of health plans in the country. And then we have sort of a fourth area of work. We've been working with Sam's Club in certain states where they're providing 90.6 as a buy-up service to the Sam's Club subscription. And
are your doctors that are available, I mean, you have several physicians in 50 states plus Washington, D.C., as you mentioned. I mean, these physicians board certified and they are available at certain times. I mean, can I follow my doctor? Let's say I engage my doctor and, you know, we talk and I get some advice and then I want to talk to that physician again. Can I schedule that appointment for follow-up with that same doctor that I engaged in initially? We want the patients to have a relationship with the 98.6 service. So, and since it's truly on demand that you can come back at any point in time, you may not see the same physician. You may see the same physician. It really depends. Obviously, they don't work 24 hours a day. We're operating a 24-hour service. So we have physicians throughout the country, to include Hawaii, who are helping us essentially provide 24/7 care without any of our primary care docs working overnight. You know, as we're talking here, I'm just thinking, you know, we all know there's a shortage in primary care physicians. This seems like a positive thing for access to primary care physician. Absolutely. I mean, in general, we're in a sort of primary care crisis. We're 20,000 plus shortage of current primary care doctors. That will increase to 30,000 in the next 5 years. Over half of millennials have no relationship with a brick and mortar primary care doctor. We need to find a way to get patients to access primary care in this era because we know that essentially reduces aggregate costs around global healthcare costs and reduces mortality. Dr. Younggren, thank you for your time. 98.6, look it up, find out about it. It sounds fantastic and fascinating. Thank you. Thanks for having me on the show. Appreciate it.
You know, this is, I guess, a byproduct of the age we live in, Shannon, that you can talk to your doc over your phone on your computer and text back and forth, send pictures of, you know, your rash or your broken bone or whatever it might be and get some instant treatment. Well, you know, it's so important with problems with access, getting to primary care doctors more available to the general public is a huge need. All right. Our next guest is Dr. Zachary DeBoard. After this on Como.